Flagler's Medical Landlord Representation Services can help developers and owners of medical office buildings, medical malls, and medical centers to successfully conceive, position, and/or market their healthcare assets. We are experts in assessing the project's strengths and weaknesses, determining the right medical tenant mix, defining and implementing the best marketing strategy. We can handle all types of medical real estate assignments and direct our efforts toward strengthening the cash flow of an existing medical mall or medical office building, assisting in pre-leasing a new development, or revitalizing and converting an existing retail center into a true medical mall. Medical tenants are appealing from an ownership standpoint. They are less sensitive to pricing. They generally commit for longer terms. They tend to personally guarantee leases. Medical tenants' expectations differ from others. MDs prefer tenant improvement dollars over free rent. They are extremely sensitive to the tenant mix as they benefit from cross-fertilization and referrals. Many require premium access, parking facilities, and direct visibility. Overall, property image and brand are increasingly important as the medical sector becomes more competitive. Over the past few years, we have developed a state-of-the-art medical real estate information system which allows us to better analyze and assess a property's potential and craft a customized marketing strategy for each property. For example, let's have a look at Bethesda Health City, a 136,000 square foot medical mall located in Boynton Beach, an asset that was acquired in October 2011 by an affiliated company and for which we provide management and leasing services. We start our analysis by assessing the healthcare environment within a 10-mile radius around Bethesda Health City. In this radius, we have identified 82 Class A, B, and C medical office buildings with a minimum of 10,000 square feet. On average, these properties are 88.83% occupied, with a weighted average base rental rate of $19.05 per square foot per year and a median age of 17 years. The studied area also includes 3 large medical centers, namely Bethesda Memorial, JFK Medical Center, and Delray Medical Center, with a combined 1,317 beds. One additional acute care center, Bethesda West, currently under construction, is scheduled to open early 2013. Our system also allows us to plot all other large medical facilities such as cancer centers and ambulatory surgery centers. We not only know the main functions of these centers, but can also access their basic financial information. We then dig deeper and access all facilities within the continuum of care. We plot adult daily care homes, continuous care retirement communities, nursing homes, and assisted living facilities. The following step is to have a more micro look at the delivery of care by plotting physicians per medical specialties. We can, for example, identify the primary care physicians, such as family practices, or specialists, such as oncologists, and export their contact information for future use. We might also want to look into ICD-9 data, the International Classification of Diseases, for any type of disease, current and projected, such as neurological disorders. This data helps us to identify physician needs and growth. We can create thermal maps to understand the population needs. Here, we see the projected population over 65, those over 75, and those over 85 years old. We can also see the Medicare coverage and hundreds of other data to understand the payer mix and its impact on physicians' practices' long-term viability. Also, using data provided by the Hospital Service Area File and the Centers for Medicare and Medicaid Services, we can assess the competition among existing hospitals. The brighter the color, the higher the competition. The degree of competition is based on whether or not a single hospital has a dominating presence in a zip code. If the largest market share of any hospital is 10%, then that zip code is considered highly competitive. Psychographics can help medical tenants validate and select the best location for their practices and better market their services to the community. In our studied area, we see that the population belongs mostly to the group called American Classics, a group that may be older, lower middle class, and retired, but still realize the American dream of home ownership. We also have access to socioeconomic information, including the total number of households, current and projected, the population, current and projected, the median household income per age, the median household wealth, gender, population under 18 years old, population annual growth rate, ethnicity, income, household value, household wealth, as well as age and education distribution. To understand what specialties would benefit the most from relocating to Bethesda Health City, we use our physician need analysis tools. If there is an inadequate supply of physicians or a medical gap, it most probably means that patients must leave the service area to receive care. To combat a physician supply deficiency, existing physicians can increase their productivity by servicing additional patients and thus increasing their utilization, or new physicians must be recruited to the market. There are currently 507 primary care physicians and 460 specialists practicing in the studied area. By the end of the current year, this service area is projected to produce 2.3 million office visits, 15 million outpatient procedures, and 103,000 inpatient procedures. Over the next 5 years, there will be a growth of 1.9% in office visits, 2.5% in outpatient procedures, and 1.7% in inpatient procedures. Due to these volumes, and the volumes and growth of procedures and office visits, this service area has the ability to support 8 additional primary care physicians and 37 specialists. Given our analysis, the location will be most profitable for the following specialties: family practices, allergy, cardiac, thoracic surgery, and neurosurgery. Based on this in-depth knowledge of Bethesda Health City medical and real estate environment, and our intimate knowledge and understanding of the existing tenants, we were able to design a tailor-made marketing strategy targeting a specific tenant mix that is beneficial for the owner, the tenants, the patients, and the community at large. Our marketing actions include 1. Direct mail and emails with videos and flyers targeting medical specialists with comprehensive analysis and property fit index studies done specifically for each targeted subspecialty. 2. Advertising in magazines edited by local hospitals. 3. Meeting with head of medical staff or medical affairs in all surrounding medical centers. And 4. One-on-one meetings with current MD tenants to generate referrals and enhance synergies, cross-fertilization, and patient referrals. The results we have obtained in less than 12 months at Bethesda Health City speak for themselves. The facility is now 98% leased, anchored by Bethesda Health System and AmSurge, with 15-year terms. Our retention rate is 100%. Average renewal term is 7.3 months. We have also attracted new physicians with similar long-term commitments. All our tenants are successful and highly regarded medical organizations, practices, and/or independent physicians. But more important than this impressive retention and capture rate is the rental base we have obtained. Bethesda Health City is the most occupied multi-tenant medical asset with the highest market rate. BHC defines and leads its market. Our medical property management and landlord rep team is experienced, knowledgeable, and highly motivated to creating value and increasing earnings for both owners and tenants while improving the delivery of quality care by providing places that are healthier for patients and healthcare providers.